atrial septal defect is basically a deficiency in the wall between the right atrium and the left atrium. An atrial septal defect is truly a hole in the heart.
Atrial septal defect can often be very silent in the beginning. As we get older, it can cause pressures on the right side of the heart to increase, and thereby leading to swelling in the legs, shortness of breath with activity, and shortness of breath even at rest if the disease progresses far enough.
In some instances, if you have an atrial septal defect, you can develop symptoms of heart failure. This happens because of increased flow that occurs from the left side of the heart to the right side of the heart, eventually leading to overwhelming flow into the pulmonary or lung circulation.
Echocardiography can be of two forms. The first form is called Transthoracic Echocardiography, and this is done with an ultrasound camera that is pointing through the chest wall. That can often suggest a diagnosis of a defect. This can be followed up by a transesophageal echocardiogram, which is an ultrasound camera that goes down the back of the throat. It sits very closely behind the heart and can get us very sensitive images and an accurate diagnosis of the defect, as well as its true sizing.
So atrial septal defects can be treated in a variety of fashions. The most common in the modern era includes transcatheter closure, and that it requires a minimally invasive procedure, usually using a catheter with needle punctures. We advance a small device, typically of the shape of a clamshell, that's made of a nickel-titanium alloy, and it allows for sealing of the hole. Sometimes, in some instances, you must use multiple devices. And it avoids the need to open the chest, which obviously allows for people to heal much faster and leave the hospital much sooner.